company that gave you Monowell, Cefurex, Faspic, and Coccidia, brings forth its newest product, an alpha-1 adrenoceptor blocker that gives relief to urinary obstruction for sure. Tamzor. .400 micrograms prolonged-release capsules of tamsulosin hydrochloride is Cathay Drug Company's Tamzor, an alpha-1 adrenoceptor blocker in the prostate that helps relieve symptoms of urinary outflow obstruction. Tamzor works by relaxing muscles in the prostate and bladder, which reduces symptoms of benign prostatic hyperplasia. The symptoms associated with BPH are related to bladder outlet obstruction, which is related to an increase in prostate size, caused in part by a proliferation of smooth muscle cells in the prostatic stroma. However, the severity of BPH symptoms and the degree of urethral obstruction do not correlate well with the size of the prostate. Pharmacokinetics. Tamzor is 99% bound to plasma proteins and is absorbed from the gastrointestinal tract and is almost completely bioavailable. The extent and rate of absorption are reduced by food. After oral doses of an immediate release preparation, peak plasma concentrations occur after about 1 hour. Tamzor is metabolized slowly in the liver and is excreted mainly in the urine as metabolites and some unchanged drug. The plasma elimination half-life has been reported to be approximately 5 hours. Indications. Tamzor capsules are indicated for the treatment of symptomatic BPH in men with enlarged prostate. It relaxes smooth muscle in benign prostatic hyperplasia, producing an increase in urinary flow rate and improvement in obstructive symptoms. Dosage and administration. Tamzor 400 micrograms once daily is recommended as a dose for the treatment of the signs and symptoms of BPH. For those patients who fail to respond to the 400 microgram dose after 2 to 4 weeks of dosing, the dose of Tamzor can be increased to 800 micrograms once daily. In cases where Tamzor administration is discontinued or interrupted for several days at either the 400 microgram or 800 microgram dose, therapy should be started again with a 400 microgram once daily dose. Contraindications. Tamzor is contraindicated in patients with previously demonstrated hypersensitivity to other 5 alpha reductase inhibitors or its components. Tamzor is also contraindicated to patients with a history of postural hypotension and severe liver impairment and syncope. Adverse reactions. The adverse effects reported in more than 2% of patients with Tamzor include the following. Warnings. As with other alpha-adrenergic blocking agents, there is a potential risk of syncope. Since selective alpha blockers reduce blood pressure, patients receiving antihypertensive treatment may require reduced dosage of Tamzor and specialist supervision. Drug interactions. No interactions have been seen when Tamzor was given concomitantly with either atenolol, enalapril, or theophylline. Overdosage. Overdosage with Tamzor could potentially lead to hypotension. In case of hypotension, Support of the cardiovascular system is of first importance. Restoration of blood pressure and normalization of heart rate may be accomplished by keeping the patient in the supine position. If this measure is inadequate, then administration of intravenous fluids should be considered. Storage. Available in Aloe blister pack in a box of 10s. Tamzor should be stored at temperatures not exceeding to 30 degrees Celsius.
Colubia is a non-steroidal anti-androgen that binds to androgen receptors without activating gene expression. This inhibits the androgen stimulus that results in regression of prostatic tumors without lowering patients' androgen levels. Colubia is indicated for the treatment of advanced prostate cancer in combination with luteinizing hormone-releasing hormone analog therapy or surgical castration. When used as a monotherapy, consisting of 3 tablets of bicalutamide Colubia, it is indicated either alone or adjuvant to radical prostatectomy or radiotherapy in patients with locally advanced prostate cancer at high risk for disease progression. A call to take action. Colubia.
When you're on a roll, nothing should stop you, not even urinary tract infections. Stay on a roll with Monurol. Monurol is an original molecule with an antibacterial action derived from phosphonic acid, indicated as the first-line treatment for urinary tract infections. It is the most active or potent oral antibiotic versus resistant E. coli. Monurol is taken as a single oral dose for 100% treatment compliance against uncomplicated cystitis and asymptomatic bacteriuria, with no cross-resistance with other antibiotic classes. It can also be used as prophylaxis for urological procedures, including surgery. Monurol has proven clinical efficacy and is recommended as first line in the treatment of urinary tract infections. For over 40 years, it has been internationally proven as safe, with no clinical relevant drug interactions. Be on a roll without urinary tract infections with Monurol.